Absolutely. Prevent blindness historically focused on areas that were a major impact to the population. I'm talking about issues such as glaucoma, macular degeneration, diabetic eye disease. But over the past 10 years or so, we recognize that there's a need for more information about all sorts of eye health conditions. And so we've really focused on expanding the library of information we have. This is partly due to the fact that there's so much innovation and research right now, and more treatments are coming out. So people need to know more about what's out there and more about various eye health conditions. So over the years, we've started looking into more lesser known conditions, and certainly geographic atrophy is an important one that to our work. Macular degeneration, AMD, is something that we've been working on for a long time. We've had education and awareness around macular degeneration, but geographic atrophy, which is a form of AMD, really didn't have a treatment until a few years ago. And so there wasn't a lot of conversation around that. So when a treatment came to market, there was a need for more information around geographic atrophy. And that's where we stepped in and started building. We created an awareness week. We started building up our content. And, it's evolved over the years as more treatments come in. There's a need for more education and information. And it's really important for us to make sure that anywhere there's a vision condition being addressed or being researched, that we're a part of that conversation. Couple reasons. As I said earlier, it's always important for us when new research comes out to make sure we're providing education and awareness around that eye condition so that people understand more about it, whether it's the patient themselves, their care partners, their friends, their colleagues, et cetera. But the other thing that we do around that link, which is so important to our work, is we connect patients to researchers, to pharma companies, to other researchers, so that they can make sure that they're considering the patient perspective when they are developing new treatments along the whole pathway from the clinical trial work to the marketing of the condition. I encourage people to go to our YouTube page. We tell stories, and we have videos on our YouTube page about all of our programs, some success stories on there. But absolutely, there are stories we hear all the time. We get letters from parents, from children who have received glasses through vision screenings and are able to improve their success in schools. I remember letters from people who were in the workforce and just couldn't afford a pair of glasses, and we're able to help them get those. Something as simple as a pair of glasses really can change a person's life, and they're able to perform better at work, and they're able to fill a need that everyone in our country and the world should have access to eye care. Sadly, they don't, and we're able to help fill that need. I think the other thing, more on kind of a disease perspective, I remember having a conversation with a woman once who had diabetic eye disease and had lost significant amounts of her vision. And she shared with me that the work that we did with her was among the most impactful work she's had, even though we didn't improve any of her vision. Our work doesn't bring vision back to somebody, but it helps support them and appreciate that they're just like everyone else, and that they should live as high a quality of life as everyone. And we want to make sure that wherever you're at on that vision spectrum, that you're valued. I'd like to share that we had some good news recently. We received a very large, almost $10 million gift from a woman who passed away recently, and that's going to be transformative to our work, certainly. But it doesn't mean that we're really going to change what we're doing. It's going to mean that we're going to be able to have more impact on that. So we're going to invest some resources in in expanding our capacity to continue to do the work that we've been doing to develop and expand some of the programs with new technologies. We're going to be launching a new awareness campaign sometime in 2025 to ensure that more people know about prevent blindness and the work that we do. And we're also in the middle of a strategic planning process where we're looking at the next 5 years ahead. And as I said, I don't think we're going to change a lot of what we're doing. I think we're having a lot of success, but we're really going to double down on that. So our new strategic plan, it's still in development, but we're really focusing on 3 areas of work: education, advocacy, and collaboration. Educating the public about eye health is so important. Advocating for eye health in Washington, D.C. Is important to make sure that policies are there to support eye health, and then collaborate. Almost everything we do is done in partnership in some way or another. So we're working to bring partners to our work and to be partners with them in their work. Well, I talked a little bit about researchers earlier. It's important for us to be the patient voice and to bring patients into research. As far as professionals, we work and collaborate with professional organizations like the American Academy of Ophthalmology, the American Academy of Optometry, American Optometric Association, American Academy of Pediatrics, to make sure that we're engaging them. They're often the folks that are at the first line. School nurses is another great professional group that we work with to make sure that we're collaborating to get information about eye health. And as far as policymakers, I think one thing I'd specifically speak to is we're currently working on a bill. It's called the Early Detection of Vision Impairments for Children Act, or EDVI. People can go to our website, preventblindness.org, and find out more about this. What this bill would do is provide federal funds to states to implement vision and eye health programs. Currently, there are no federal dollars going into vision and eye health to this degree. And so we think passing this relatively simple measure that has bipartisan support in Congress is going to be a huge step forward. First of all, we rely on our corporate partners and the public to support our work. And going to our website again and hitting the donate button, whatever that is, if you can donate $1, $5, $500, it helps support our work. The other thing they can do is visit our social media channels. Again, those are all accessible on the homepage of our website, but we're on pretty much every social media channel. As I said, we have a growing YouTube presence, and I think really becoming engaged in our social media, promoting it, sending that out to your friends. So much of what we do is done through our digital presence, and so coming in and supporting that work is a really important way that people can help out. One other way that Prevent Blindness educates people about eye conditions is we have various eye health campaigns throughout the year. There's Glaucoma Awareness Month in January. There's Diabetes Awareness Month in November. And in February is AMD and Low Vision Awareness Month. So throughout the month, we're providing education and resources and information about age-related macular degeneration. And we're also talking about the importance of low vision. And we have a resource called Living Well with Low Vision. Again, you can find that on our website that provides all sorts of resources for anyone living with low vision. Again, along that full spectrum of vision or vision loss to live their highest quality of life possible, whether that's providing them with access to get low vision reading devices or how to access transportation opportunities in their communities. There's a wealth of resources on that website. So I encourage people to come again to preventblindness.org to learn more about this. So I spoke earlier about our patient engagement program, how we connect researchers to patients and others. And so a few years ago, we started this initiative called the Aspect Patient Engagement Program. And what it does is it brings together 30 patients or care partners or allies a year virtually. They go through a 10-week program, about an hour, hour and a half a week, where they learn to tell their stories, where they learn about advocacy, about what's involved in clinical trials, all sorts of things to better prepare them to be advocates, not only for their own eye health, but for that of those around them and for the country. And it's a really terrific program. We've so far graduated over 200 people who are active advocates and actively engaged in advancing eye health with us. So for the EDVI ACT, it's really important in order to get this passed for people to speak up and to help us advocate for how important children's vision is. It's easy to get involved, regardless of who you are. You can go to our website, type in EDVI, but it should be there right on the homepage. There are ways that you can reach out to your member of Congress and say this is important. Send letters. You can pass that information on to your friends. If you want to get more involved, reach out to us. We'll connect you to the staff who are leading that. This is a really important bill, and it's going to be monumental for our organization and for children's eye care when it's passed. So we appreciate any help that we can get.